Okay, so my name is Dr. Kanari, as Noor has mentioned. I work for AMREF Health Africa under the enterprise arm, which is now AMREF Health Innovations. And there I'm the clinical business lead. And so we generally do a few things, but it is the innovations arm and social enterprise arm for AMREF. AMREF Health Africa is an NGO that is international, but headquartered in Kenya. But we have 35 project offices or 35 countries currently that we implement projects in. And then we have at least 11 fundraising offices that are not within Africa, that are in Europe and in America. So in a nutshell, that is what we do.
Okay, I think I'll go next. So my name is Bisola Asiru, and I work for the African Medical Supplies Platform. The platform was established as an emergency initiative by the Special Envoy to the African Union, Mr. Strai Masiwa. Basically, we were mandated to create a platform where African Union member states could procure various their needs for COVID. And so basically, we started this project in early May. So it's just about 7 months now. And basically, we've just been helping African Union member states, as well as some private enterprises now to help with their procurement needs. Yeah, that's pretty much the intro.
Thank you. And my name is Clement Jaidzeka. I'm the technical officer for Global Health Supply Chain Technical Assistance Francophone Task Order. I know it's a long name. Ours is a project or a task order under the Global Health Supply Chain Task Order, which is USAID's largest single procurement. And this task order, we focus on providing technical assistance to Francophone countries. Right now we have project offices in Benin, Burkina Faso, Senegal. We used to have an office in Haiti. Our biggest project is in the Democratic Republic of Congo, but we also provide assistance in Togo and Niger. And one of the great works we've done under this task order has been the emergency supply chain framework, which we'll be talking about more, but is basically providing guidance on how to set up and optimize supply chain operations during emergencies. Thank you.
Thanks, Clement. So, this is very interesting to me when you mentioned supply chain, because I think at the beginning of, COVID, one of the difficulties we had was actually the supply chain and working with various airlines to move sensitive items, right? It was I was just wondering the kind of challenges that you had. So, on our side, just as an example, we had a country that was, a CARICOM member state, and actually the difficulty was actually transporting something from Europe to that state simply because the packaging could not last more than 10 days. So I don't know if it's something that you encountered, because you were talking about, optimizing the supply chain or making it easier for anyone who is trying to procure. And I don't know if you had that kind of challenge on your side.
So that's a really good point, and it's a challenge that project-wide, even for our project, we've had this challenge, even under the Global Health Supply Chain Procurement and Supply Management project. Us, we focus on providing in-country technical assistance, which includes getting waivers to make sure that commodities get out of the port of entry, either seaport or the airport or whatever land crossing, faster. But in terms of freight, definitely during, at the start of the crisis, when major airlines, when countries put restrictions on travel from especially Western countries, and there were very few cargo shipments or even commercial flights, it really put a bottleneck on the availability of freight routes. So that consequently led to a shortage of commodities in country. There were delayed deliveries of products. So we definitely saw similar challenges in our countries. And some of the work we were doing is that we repurposed this emergency supply chain framework and really focused it on the distribution and warehousing aspect of it to optimize the distribution of commodities that were actually already in country, that they got to, the last mile, while trying to get upon the bottlenecks that were preventing or slowing down the delivery of new commodities.
Thanks for that. That's very, very clear. I think even on our side, because you are talking about distribution within country, but we offer, the service that we offer is basically to one port of entry. So we basically discuss with our with African member states, and we say we're able to distribute to, say, Nairobi, for example, but we can't distribute within Nairobi. So I mean, I guess if they wanted to do like a distribution within Nairobi, that would be more of your expertise. But even then, it has been quite challenging. Catherine, I was wondering if you had any something on your mind on if you had any challenges on the logistics side, or if yeah.
Definitely, we've all had challenges on the logistics, and maybe I'll take a step back and look at the pandemic wholesomely. As Africa, first of all, we were not prepared. We are never prepared for pandemics to some extent, especially because as we watched, numbers were not growing in Africa. They were more or less growing in the Western world. And so a lot of skepticism and a lot of, I think at the level of the household, I'd say lack of insights and lack of knowledge, and the communication that was coming in was kind of conflicting to some extent. And then here we are giving advice for people not to go to health facilities because they are going to expose themselves unnecessarily. And we have a large population, especially the NCD cohort, that really do require to get this medication and using their normal supply chains. And I remember one of the tertiary hospitals, one of my friends who's actually a doctor, being unable to get her diabetic and hypertensive drugs as they've been out of stock. We are in a devolved system in Kenya. So our counties have sort of ministries of health within the counties. Now it became all funds had to be stopped for normal programming to then be redirected for COVID. And this meant a lot of PPEs and a lot of looking at how they will do the testing and looking at how the capacity within the facilities to then be ready for this pandemic. So that generally also affected supplies and normal programming. This includes things like family planning commodities. We're looking at ANC commodities. In general, the normal running day-to-day of hospitals. So those are challenges that have arisen and have been ongoing. And I think as AMREF, we have primarily sat at a position where we are able to then dialogue with government, dialogue with counties, and then also look at how then we negotiate as Africa for getting these vital commodities to our countries and to our health facilities. So there have been challenges, and we approached it, I guess, in a multi-pronged way. One of the biggest things that we did have to do then was capacity build on COVID from the community level up to the healthcare worker. Secondly is then to have those dialogues and negotiations with counties and government, and to sit in these decision-making spaces where we agree on, as a country, what are we looking at as our way forward? Because we are realizing, especially the NCD population, which is a double tragedy, because that population, again, is the one at risk of contracting COVID. And so if we cannot get insulin to a patient, then we're doing a disservice to them. So these are challenges that have been ongoing. We have been in talks and we sit with MSH, for example, who then assist us, especially on the supply chain end-to-end, looking at how to improve these systems and how to proceed even within the pandemic to ensure that these vital drugs and essential drugs do get to the end user and to the facilities. Thank you.
No, thank you for that summary. I think that was going to be my question to you about from the clinical side. How are you managing to make sure that there's no disruption in services, especially for those who need it the most? And I think one of the things that we developed with this emergency supply chain framework was that it has 3 components. There is the best practices component, which looks at how various emergencies have been managed across the globe, including Ebola, cholera, and dengue, among other diseases. And then it also comes with what is called a best response guide, which is basically a chart that says whom should do what should the general management team be made of. And a key component of this is getting all the various supply chain actors in country, including public sector, so government supply chain experts, as well as programs and multilateral organizations. Because as you know, with supply chain, it's interesting that you just mentioned working with MSH, because there's MSH, and then you have UNFPA for family planning commodities, and then you have PMI and PEPFAR for HIV commodities and malaria. And so what this does is getting those partners together and developing a framework for a response for the country, including both the public and private sector, and also identifying from the private sector. In most of our countries, we realize they get implicated mostly at the last mile distribution level. But so identifying those 3PLs and 4PL private sectors who could take the commodities to ensure that the most disadvantaged get these commodities even in times of emergency. So that's one of the things that we try to do. And I would say for Africa, this playbook had been adopted. We piloted it in Cameroon, and I know that Kenya also adopted it and implemented it for the country, and so did Burkina Faso and other African countries. And also the DRC, because we sent out this knowledge to our projects, and they were going through an Ebola outbreak at the same time as COVID, some of those lessons were able to be used in how they handle the outbreak. And I think it's one of the reasons why Africa, fortunately, hasn't seen the kind of explosion in cases and casualties that had been predicted in the beginning. Thank you.
And maybe just to add to that on the clinical side, so a few things that we have managed to do as an organization is actually come up together with government and with stakeholders to have a continuation of health services sort of protocol despite the pandemic, which has been quite successful. How do you then carry out the normal day-to-day despite having these challenges? And it has meant that we've seen services ongoing within health facilities, having had to do the necessary precautions that are there, and having urged citizenry and citizenship to then also follow the same protocols, just to reduce on spread and potential spread, but also to ensure that people are then now, we're not going to reverse the gains we've already made, especially for communicable diseases. As you've mentioned, malaria, HIV, TB, we know all these things are very important and play a big role within our health sector. So just ensuring that we are collaborating and cooperating with all stakeholders to come up with this continuation of health services during a pandemic sort of protocol. So this has been rolled out at least for Kenya, and it's ongoing, and we're seeing more or less some sort of return to normalcy. I think for us, of what I see as a challenge is then preparing and working hard at our cold chain, because that has been a problem, especially for anti-cancer drugs and things for diabetes, the basics. And then as we anticipate the coming of the vaccine, we need to have gotten our cold chain together so that we are able to get to the people in need. So those, I think, are glaring issues that we need to actually sit around and tackle. Even preparedness of citizenry to take the vaccines, there's a lot of skepticism still. And because it's not as dramatic as the other pandemics that we know of. You're not seeing someone bleeding to death. You're not seeing such a quick progression. And already we have the notion that, oh, unless you have diabetes then or hypertension, then, I mean, you're young, we are protected, we have strong antibodies. So I think that therein lies a challenge in then behavior change communication and even in vaccine acceptance, especially for adult vaccines. So those are some of the things I can foresee in terms of preparation and next steps within implementing health services in a pandemic.
Thanks, Catherine. So that's so true, because I mean, when we first started, the biggest categories for us were diagnostics and PPE, and the next thing was we were talking about. I mean, vaccines now is the order of the day, and we're trying to, speak to various manufacturers about it. And obviously, some of the difficulty of the cold chain. I remember when the news came out about Pfizer, and I saw something about minus 70 degrees. And in my head, because of the experience we had even with with PCR, I was like, wow, how on earth are we going to manage this? That was the first thing that came to my mind, like minus 70, as just going through. And then obviously we have other players who are saying, some are saying room temperature. Pfizer is saying, oh, there's a special box they can use. I mean, but you're very right that we need to get everything together. Another point I would say is Africa as a continent, I think we have greater strength in numbers. Like when we negotiate with these companies, for example, I mean, at the beginning of the pandemic, when they gave the allocation to Africa, I think it turned out to be something like 48,000 tests per country with the allocation that I think the WHO gave. And that was grossly under what was needed, looking at the fact that we have over 2 million cases. So we had to, and that was also part of the reason why this platform was actually established, to get an alternative source of supply. And so this is going to be the same for vaccines. I foresee it, because from the conversations that we've been, I mean, the way Pfizer has been, and let me not use Pfizer, but a lot of these companies have already dedicated a lot of their allocation to the Western countries, and we are trying to see how we can fit into it. We also, I think if we come to the table as a continent and we say this is what we need, and present this united front rather than countries going and having alternative arrangements, I think there's bigger strength in that. I don't know if you agree with that principle.
I think definitely, because that you're looking at the pooled procurement, pooled needs, pooled resources, and negotiating power to then actually even get it in affordably. Then also looking at the cold chain and how prepared are we? I mean, for us, when I look at Kenya, the only people who can handle anything minus 70 is just one institution and may have maybe 2 fridges. And so they need to then negotiate and say, fine, it can work in those other countries, but for Africa, we are not prepared to handle a vaccine that will need a minus 70. I actually saw that and I was like, wow, this is hard. Looking at even health facility preparedness, I mean, we don't have electricity consistent electricity in some areas, even in the country, and they will need this. So it calls for us to again sit as countries and as a pooled sort of thinking and say, okay, we have the 0 to 8 fridges. Is there anything that can then be done to reach these temperature levels that can form a viable vaccine? Because even the handling and transportation of the same, how will you transport this vaccine and it reaches the end user viably? So those are real challenges for Africa, and we're looking at temperatures definitely in the tropics. So I mean, we will need a good solid cold chain as one of the key preparations for handling this vaccine.
Bisola, thank you, and Catherine, for this. I think that brings up an interesting point. You mentioned that for Africa is going to be strength in numbers in terms of negotiating how much of the vaccines we get and the pricing for these vaccines also. Do you think this is an opportunity for countries to and organizations to help countries build supply chain capacity? Because as a technical assistance project, one of the things we consistently see is the lack of, like Catherine mentioned, cold chain capacity. But if you think of supply chains as a whole, because our countries have such varied systems. In West Africa, which is mostly Francophone countries, you have different supply chain systems. For instance, the supply chain system in Cote d'Ivoire will be different from Nigeria. and Ghana would be different from Cote d'Ivoire. So even in terms of pool procurement, as you were discussing, different organizations or different agencies are in charge of procurement in these countries. So with such varied systems, how do you think you can go about pool procurement and about building or improving the capacities of supply chain, as Catherine mentioned, to especially for cold chain, and by extension, just the supply chain in general? Because as if we are seeing an era of pandemics, just the distribution of commodities or vaccines or drugs for these, we would like to not repeat some of the supply chain shortcomings we saw during the Ebola outbreak in Guinea, Sierra Leone, and Liberia. So I'm interested to get your thoughts on this. Thank you.
Okay, so I mean, this is such a great question, and thank you, Clement. We've actually done, I think we've done one round of distribution across the African Union of, so initially we did a distribution of dexamethasone, and we also did a distribution of some diagnostic test kits. And, you know, according to the ACDC formula of allocation, they were to go to the different member states. Now, it sounded very simple on paper, but even when we started the process, it was challenging. It was very, very challenging, because it was a pool procurement. It was ideal in the sense that everything was shipped together for the countries. But when it got into Africa and the actual logistics of moving it across Africa began, that was, I mean, I cannot put it into words, right? Another thing is like, making sure the countries are willing to receive, because it was a donation in this case. The countries did not actually have to pay anything, but some of the health, the ministries of health were a bit skeptical about it, and some of them said, I mean, not many, but do we really need this? And sometimes it would be a case of it would get to a country and get stuck in customs, and there were all sorts of challenges across the board. So I mean, it's going to be this. I think just learning from our experience. Now we have another distribution of antigen tests that is going to begin this week, actually, and just taking our learnings from last time. It's just about, you know, over communicating with the countries, like constant communication, and partnering with different implementation partners within countries. So Chai, for example, is in quite a few African countries, and we've had a couple of calls with them and just leveraging on their own expertise on how we can actually work with the countries, working with the ACDC to see if there would be any fallback. And they also helped with the communication as well, so that there's like a clear heads up that, oh, this is what is coming and this is how it's going to come, this is the timing. So they just have all the information they need, and we don't have issues of things getting stuck, and you know, and just maybe the general bureaucracy that can always happen when it comes to governments. I mean, so that's it. It's like we had the first experience, which was a bit, you know, there were ups and downs, and we finished with that, and now we're on the second one, and we hope to just as we go forward and refine and we distribute. When it comes to vaccines, we would have put all our learnings together and be able to like cover the continent in an effective way.
No, thank you for sharing that experience. I think before you go, Catherine, I think the tool or the framework that we developed was developed and piloted in 2018. So it's pretty recent. And I think some of the challenges that you are just going through, some of the things that we tried to prepare countries for in this tool. And one of the aspects you discussed is countries accepting these commodities. And one of the things that the governance committee for this does is that it already anticipates these problems, because just because a commodity has gotten into the country, you know, there is warehousing fees for the week or so that is there, and then there is distribution fees, and most of these you don't really expect the country to pay if they have limited resources. So thinking through which of the multilateral partners would be a source of financing for this. So as you are working on the pool procurement to get commodities for countries could be talking within them to see where they could leverage the financing for the distribution and for the warehousing and distribution of these commodities once they get in. And another role would be working through maybe a waiver system to make sure that these commodities are prioritized once they get in country, because if in an emergency, you don't want them following the same procedure once they get to the port of entry as during normal times with all the inspections. You want to get a fast-tracked approach. So those are some of the things we talk about. So I think after this, I'll be glad to share that with you. And as you work with these countries, especially in this emergency, maybe something that will be very useful to quickly walk through some of these challenges. But I completely understand we deal with them every day. So it's maybe this is an opportunity to finally walk through some of those.
Thanks a lot. I appreciate that.
Yeah, and even listening to that, it looks like kind of the similar situations we did have a while back, maybe in this country, where we have Gavi distributing for us vaccines, but suddenly our role, which is to find the specific the commodities that are needed to then give the vaccines, so the syringes and the needles, and that was not procured. And so you have the commodity, yes, but you don't have the things that go along with the commodity. And so it needs to be looked at wholesomely. And I know for that, one of the key things was that for them to supply the vaccines, then we have to also put in something in that kitty that will then take care of the other associated commodities for this. And similarly, the way Global Fund seems to operate. So not seeing, looking at it in the short run, but in the long run, that then we would need to prepare and to, as you said, over communicate and say, fine, we will get the commodity as is. And this is what we may need from your governments, or we may need from implementing and developing partners to then achieve what it is we want to achieve, which is vaccinate our communities and then have health within them to help in the prevention of the pandemic spreading. So those are things that, yeah, need to be looked at wholesomely. Thank you.
You're very right, Catherine, on the, I mean, the associated instruments needed for the vaccine. I was on a conversation with one of these pharmaceutical companies, and it was actually mentioned that it's one of the things that's always overlooked. It's just like you're buying tests and you don't buy the instruments, right? And it's, you know, so people overlook it. And I think that's one thing we're going to focus on in the coming months, like even as a preparation. While we don't know exactly when Africa is going to get the vaccine, I believe that countries can actually begin to prepare by getting those things in place. So getting those instruments, the tools, fridges, whatever is needed really, and have that on the ground before the vaccines actually ship. And then I think everybody would benefit once the vaccine arrives, then it wouldn't take so long to begin to distribute it across different countries.
Yeah, completely agree. And I think those are, I wouldn't say they're cheaper, but they're sources of procurement that I think most governments and most partners that work in supply chain in country either have the funding or already have the mechanism to procure. And some of those would be PPE, obviously, you know, gloves, like you mentioned, syringes. And I think, again, we have in this framework, it has 17 disease-specific guidelines. So when you're dealing with a particular disease, if you're dealing with Ebola, you don't even have to be sitting around trying to figure out what are the commodities you need to deal with Ebola. Like, it has a very Ebola-specific guideline for what to procure. And we just updated it a couple of months ago to include a disease-specific guideline for COVID-19. And it's in French, English, Portuguese, and Spanish. So I think these are all things that we were to put at the hands of our governments as they get ready for the vaccination campaign. It would prevent situations like, as Catherine mentioned, where you have the vaccine and you have the population that needs the vaccine, but you might have the syringes and the gloves, but you don't have the right protective equipment for the health workers. And we know that in outbreaks, one of the biggest casualties is always lack of protection of health workers who then go down. And then you have a double problem because you don't have anyone to administer health care to the sick. So I think so I think there's a great opportunity here, but it's good to see that we are all thinking about this and bringing this to the forefront of conversations we're having in the respective countries where we're working. So my question is for Catherine. You mentioned getting a conversation out there about the vaccine, getting people ready to accept and take the vaccine. Can you talk somehow about some of the steps that are being taken about it? I mean, I know that you touched on the reasons why people might not want to take it, thinking, you know, that we have the antibodies, we're young, it's not here. And you spoke a little bit about the campaign or change to talk about this. Can you elaborate a little bit more on that?
And so basically, as part of that vaccine preparedness, looking then at agencies that are good at communication and doing some sort of surveys, knowledge assessment, and just seeing what insights are there in the communities. I guess things have changed since the beginning of COVID till now. Most people do actually have either known a family member or seen a healthcare worker, but most people are now really aware. And I think the key thing is to get the proper messaging out. You know, for Africa, we shroud things in stigma and secrecy, including normal vaccines, where there's a time we were being told that even for tetanus toxoid in pregnant women, that we're introducing infertility, you know, religion comes into play and a lot of politics and all that. So generally passing communications that will allay that anxiety, because people might decide this is the Western world then doing testing on Africa and they don't know, or we are the guinea pigs and all that. So it really needs a proper campaign strategy that will also border on giving the good facts or the real facts about the vaccines. We do know that we're anticipating maybe sometime next year. And so just keeping the public aware and knowing what is happening. And then what to manage their expectations, which still involves giving them proper communication. So such items are key, they'll go hand in hand. So looking at the communication stakeholders, looking at the Ministry of Health and what messaging is coming out. I can tell you for now, everybody knows to wash their hands, to wear masks, but we don't know much about the vaccine. It's still somewhere shrouded in secrecy. We hear it's being developed. How long does it take to develop? Why so quick when we get to Africa? So just giving the proper communication and giving the expectation that once you get this vaccine, this is what is expected, or this is how your body will then act, or this is not a lifetime guarantee that you will never ever get COVID. So those facts, they're really crucial. Yeah, just in essence, the communication that ends up to the end user.
I mean, that's so true about the communication. Like even with from the whole move of PCR, for example, and PCR and antigen test, even convincing governments about, I mean, the efficacy of antigen tests has been quite tricky because, you know, the governments, they know what they know what has been working, you know, they take the test to the labs, and we're trying to, you know, communicate and explain that the quickest way we can open up the countries is via antigen testing and repeated testing. Like, I mean, that's the strategy. You keep testing because people are worried about false negatives. If you test 1, 2, 3, and you see that, oh, it's a negative, then you would say, okay, this person doesn't have COVID. But people have these impressions that because it's a fast test, it's not as effective, for example. So that's just one, you know, something that you would think wouldn't be so complicated to communicate, but it actually is. And I mean, it would be the same for vaccines as well.
And from a regional level, have you seen, based on the experience from past outbreaks or emergency situations in the region? I know that in Bisola that there was, and there is still a Lassa fever outbreak in Nigeria, and the government, and there was the Ebola, an Ebola case there that was very well handled. Are you seeing, in terms of government communication, as you mentioned, any use of that experience to kind of repurpose it to handle COVID. I know there's an outbreak everywhere. It's a global pandemic. And for Catherine, for Kenya and the sub-region, I know a couple of years ago, there was a yellow fever outbreak, and there was actually a shortage of yellow fever vaccines where they were giving half dosages at some point just until they could get the proper dosing back up. Are you seeing any use of such very recent experiences being targeted or repurposed to prepare the population for this COVID pandemic?
So a mixed pot. I don't think we have any tangible, so to say, resource. Okay. I know at the beginning we did start by putting away a fund as a government for COVID. And I know, for example, in Kenya, civil servants took a pay cut, and this money was to be repurposed for then COVID in terms of PPE, all aspects of COVID. It is not clear where the resources went. It is clear that there are items that were then brought in. Some were aid, some were not. So I don't know moving forward if it's something we need to then have clear discussions around. We know governments are struggling because of COVID. Business has gone low. We undertook tax cuts as a country just to cushion the population. So that might be worth having a conversation with stakeholders. How ready are we? Even financially, what are they able to put in to actually support the treatment, support the prevention and the vaccines? So that might be another discussion, and it will require several stakeholders, including insurance companies, because I know, for example, here when COVID first started, even up to now, insurance companies are not covering COVID and COVID-related treatment, or are covering to an extent. And so I know what many companies, including AMREF, have had to do is have a fund set aside for contingency for COVID. So these are real discussions. When we are looking at it in terms of general population, then how do we go about it? If private insurance companies are not going to pay, our National Health Insurance Fund, which is our sort of social fund, hospital fund, might not have the capacity to cushion. So these are the real questions. So who pays for what, and what are we able to put aside for this impending reality? So those are things that need to then be pushed again to the stakeholder level, just to be clear on what it is we can do and on how then we go about it in terms of finances.
So, I mean, on the Nigeria side, it's a bit similar, because you were talking about Lassa fever, and the truth of the matter is the average Nigerian wasn't really aware of what was going on, because I think so something that was up in the north. And so, I mean, because it's not in your face, you know, I live in Lagos, so people were they didn't know what was actually going on. But if you were to go on the NCDC website, you would see them reporting figures and so on. I think when it came to COVID, I think our National Center for Disease Control, pretty much, I think this would be the first time we had such a pandemic that, you know, it gripped the entire world, and they had to change some of their approaches. And so we had things like they were sending text messages to everybody saying, no, this is what you need to do. You need to wash your hands. You need to wear a mask. The governments were, you know, the respective governments, state governments were also running their own communication campaigns. And they were also appealing to private organizations to donate. And this was more on the, you know, because people lost jobs, it was more about getting food, I mean, the basic staples. And so they were asking these companies to give food, and in exchange for tax cuts, for example. So that was something that they did, which was actually quite good, and they were trying to distribute this across. So I mean, the NCDC, I think it's still evolving, and I mean, as time goes on, I think the base that they've established for communicating about COVID and preventative and getting people to accept it. But I mean, it's a gradual improvement every day, I would say.
So, so what about the private sector? I think we've covered a lot since we both work a little bit more involved with the public sector. In terms of the private sector, I know they've been very hard hit by COVID because of most of the restrictions and shutdowns in pretty much across the continent. And so do you think there's a way they could be more involved? Because I know that personally, the private sector in most of the countries we work doesn't tend to be as exposed to the public sector. So as we are discussing COVID vaccines, like the procurement of COVID-related equipment, such as, syringes, gloves, PPE, I don't know how involved they've been. And normally they have capacity and they are more spread around the country, which to help with distribution, but they always seem to be cut off from such discussions. And I think when it comes to even something like COVID, that is even more heightened, it tends to be more concentrated in the public sector. So in terms of even communicating, I don't know if you've seen them more involved in preparation for the distribution of the vaccines, if you've seen them more involved, because I don't get that sense from the countries we work. So I was wondering if you guys had different experiences or were seeing something different.
I mean, it's interesting that you say that, because I think initially when the platform was established, we had a lot of enterprises. They were asking already, oh, is this open to private enterprises? Is this open? And we're saying, no, it's the government for now. And I think ever since we made the, okay, come and see what you can get from us and how we can help, we've actually quite had a lot of private enterprises in the pipe. Some of them are trying to they're trying to donate as well. They're trying to have donations given across a couple of countries. Some are doing donations within the country. Some are trying to provide various PPE at a low cost. I mean, but at the same time, it's you also have to filter from people who are just there to just buy and resell. It's a very, we have to do a lot of vetting, because some people come in and they say they're going to do something, and if you sell to them, they're just going to increase, mark it up by 200 or 300% and then sell it on. So I mean, there's always that risk, and so we're very careful to to vet whoever we're working with as a buyer to make sure that doesn't happen. But I would say quite a few private, it's quite encouraging, I would say, the amount of interest.
I think on my end, yeah, again, having sat in some discussions, especially with big pharma and listening to their approaches and what is it that they would like to do. And again, appreciating, as you've said, that they also do have vested interest in as much as they have their access programs and their access arms, they also do have a bit of vested interest. And just seeing that at the heart of this discussion is actually the patient or the community at the end of it all. So when we look at it, we do not want an experience where it will become an out-of-pocket expenditure to get this vaccine, because it's an essential one at this point in time. And so just ensuring that it is included also in our essential lists for maybe vaccines, so that the government is able to also have some sort of way of leveraging some funding towards it. And yeah, in essence, just ensuring that we do cushion the end users and the ones in need for this. Remembering that healthcare workers are among the frontline who really need these vaccines and who really offer services that cannot be replaced. And so just as we are even discussing with the private sector, just bringing that to fore that in essence, it may be a life and death, or it is a life and death for many frontline healthcare workers, and again, for people with NCDs. So these are things that need to be discussed, even as we are engaging in discussions with the private sector. I think for me, in my closing remark, I would say that the key ingredient, and that will remain the key ingredient, is communication. And at all levels. So from the user to the government to the private sector, and that transparency and integrity that we are not then trying to create markets or trying to push something down people's throats by force, but collaborating to see then how we manage and we reach a place where we have actually managed the pandemic in African countries who are ill-prepared and more specifically having a poor resource setting, which is a double tragedy. So just seeing what is the best that we can offer at this highly needed time, and ensuring that that communication does get to everyone, including all the stakeholders, just to see us cross that bridge of having good health systems that are agile and respond to pandemics, and we can still then continue giving our normal health services to the people and to people in need. Thank you.
So in closing, I think for me, I mean, Catherine has made an excellent point in communication. We can't, there's nothing like over communicating, right? But I think something that is also important, and which you touched on, is collaboration. So, I mean, all of us are working in different capacities to, to manage the outbreak of COVID and hopefully having us return to, normalcy. But I think there's strength when we stick together. So I know, Clement, you were talking about, you have experience and expertise distributing within country, which we don't, and we are doing it from one point to the other, and you have more expertise within countries. So I believe that even us together working on various initiatives on how we can work with this vaccine and get it distributed in an effective way would also be very helpful. And I mean, collaboration is also what we're going to across the African Union. If we're able to pull together and negotiate on one table for these vaccines, I think it will be for the benefit of us all. And so, yeah, that's my keyword: collaboration.
Thank you both. I think for me, I'll be looking at more of capacity building within country and utilizing what every country already has. I think given the years of investments by our countries and by other multilateral organizations, I think that in most African countries, especially looking at the private sector who are already there on the ground and mobilizing them and maybe building up what capacity they have and closing the gaps they lack is a faster way to kind of use this outbreak and as an opportunity to kind of strengthen that collaboration between the public and private sector in solving the country's problems. Because both of you working for your organizations, you see how long it takes to plan and implement a capacity building initiative that is top down. But I think with the capacity, as we're looking at private sectors that are already in country, engaging them might be a much faster way to build longer lasting capacity that is not just focused on the public sector or on the private sector, but helping each of them use each other to respond to the needs of their respective countries. And all of that, as you said, would be done through good communication and collaboration. So, thank you.